Hey there VCE HHD students. In this short video we're going to look at what are examples of social actions for Unit 4 VCE HHD. Before we dive into that question, just a reminder over at the Health Resources Hub YouTube channel, a useful video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know to do so too to get access to all of those videos. I'm running the ACE HHD exam preparation sessions coming up in the September holidays. There's 2 sessions running, and so you can go to book.acedvce.com. There's the opportunity there to get your notes shipped for free, and also if you bundle it with other subjects ACE is offering like biology and psychology, you can get a discount. You can also see our social media links there where you can get alerts to the new videos coming out each day, and also an email if you've got any questions or suggestions for videos you'd like me to work on. So in terms of social actions, this is relevant to the following key knowledge point and key skill from the end of Unit 4 Area Study 2, the last key knowledge point in the course. So you can see there it mentions that you're required to know ways in which individuals can engage with communities or national and international organisations to take social action that promotes health and well-being. And the key skill is asking you to be able to describe and justify ways of taking social action to promote health and well-being. So you might be wondering, well, what does it mean, when referencing that term social action? So these are typically behaviours that people can engage in to help improve the lives of others and try to solve problems in communities. And so typically for this aspect of the course, we're talking about things that people such as yourself or myself could do, within Australia that would help the lives of other people that might be less fortunate to help try to improve their levels of health and well-being. So that could be others obviously within Australia, but also over in a lot of those low-income countries that you would have been looking at throughout Unit 4. So you can see here I've listed some examples of social actions. This is not an exhaustive list, but these are some of probably the ones that you might have touched on in class and might be most relevant to questions that could pop up in your SAC in the exam. So you can see that the first 2 relate to non-government organisations such as World Vision. So an individual could donate money to a non-government organisation who's carrying out then some kind of project in a low-income country. That could be, for example, improving access to things like clean water or maternal health care. You could volunteer for a non-government organisation. So, for example, you might take a year off after high school and choose to go overseas and volunteer and work for an NGO, such as improving access to things like education, so literacy and numeracy skills maybe for people in low-income countries. You might sign, say, an online petition, which might be trying to perhaps petition a government in a low-income country to try to change, say, a policy that might help people in low-income countries perhaps to have better access to things like clean water and sanitation. You might conduct a fundraising event, so that could be here in Australia, and then donate that money to, say, an NGO or directly to a community in a low-income country. You might lobby, say, the government here in Australia and ask them to try to donate greater funds, perhaps to NGOs or to causes that are helping people in low-income countries. You might organise a boycott, so that boycott might be for perhaps the products that a particular company is making. That means that people are working, under conditions that are not good for their health and well-being in a low-income country, and that might mean that less people buy their products, and that might mean that these individuals then are able to be helped in low-income countries perhaps because it might lead to, say, a raise in their wages or their conditions as a result of that boycott. That company might change their actions. You could start a social enterprise activity yourself, so that might be where the profits, of something that you are selling might be donated towards people in a low-income country. You might implement an awareness campaign, so that could be through social media, which might encourage people, for example, to say donate money to an NGO, or to sign a petition that helps people in low-income countries, or you might buy products that support social actions to promote social change. So some products that you can buy in the supermarket, a portion of the profit might go towards, say, providing access to clean water for people in low-income countries. So whenever you think of a social action, what I encourage you to think about is, what does it mean for the people that it's helping in terms of their health and well-being? So always thinking about the people at the other end, perhaps in a low-income country, and how it could improve their health and well-being. So obviously if it meant they had better access to clean water, they're less likely to contract waterborne diseases, it's better for the functioning of the body and their systems and their physical health and well-being. So make sure you practice making that link. Okay, hopefully you found that video useful. Don't forget the Health Resource Hub YouTube channel, the ACE HHD exam preparation sessions, our social media links, and our email. Thanks so much.